I'm Antoni Chan. I'm a consultant rheumatologist from the United Kingdom, and I'm here at Eular 2024 in Vienna. And we've had a whole wide range of topics discussed from the clinical, but one area that has came to my attention was a session today here at Eular, and it's probably something that we have not been really spending much time discussing in the past, but it came to my attention, and this is in the whole subject on planetary health. So I think we would be, I thought it would be useful for us to kind of go into this and to see how this impacts our the care that we provide for our patients. And I'm very glad that Dr. Nelly Ziade, a consultant rheumatologist from Beirut in Lebanon, is able to join us. And this was a session that she co-chaired today with Mary Lucy, another rheumatologist from Portugal. And so thank you for joining us, Nelly.
Thank you, Anthony. It's a pleasure to be here.
So the first of all, can you introduce to us this topic of planetary health? Firstly, what it is, and
Yes,
what is the whole aspect of this?
this is it's a very important topic. So this is what Eular put this year under innovation session. So this is the first time that we do a session like this in Eular, not directly related to our rheumatic diseases, but more global. So it's a global concept. It's even beyond the global health, beyond one health. So the planetary health is how the health of the planet is interlinked to our own health, how we are all connected in what we do, and especially to our physical health and the rheumatic diseases.
So if we could kind of link it back to in the field of rheumatic disease, clearly we have the global issues that we want to discuss, but also if you think back into our rheumatic conditions, what were the key highlights of this session today at EULA with regards to this connection between global health and rheumatology?
Yes, so the session started more globally. So, what is the concept? What are the key ideas about planetary health? And what is the importance of the biodiversity that we are losing? Because, like in the past 70 years or so, we have lost about 70% of the living species, which is really, really huge. And this will surely affect our health. It will affect the climate change, the pollution. And then we went to the second level where we connected these planetary problems with the general health. So what can you do to improve your health while improving the health of your planet? So just to give you an idea, for example, if you take a bike to work, you are doing a very good favor to the planet, but also you are doing a very good favor to your health. If you take a walk in nature, you are also getting close to nature, so you come to protect nature, and also you are doing a very good deal, good thing to your health. And finally, a third example that we all our patients ask about: what should I eat? So it turns out that the anti-inflammatory diet, where you eat more plant-based and less meat, is also something very good for the planet. So it's like a win-win situation between the health of your patients and your health. And finally, the final talk presented a lot of studies about the impact of health and pollution on autoimmunity, sometimes on antibodies, on disease flares. So whether it's the small particle, the particulate matters, or the overheat, or the climate change, or the pollutants that you have in food, all of this can also trigger rheumatic diseases. It can trigger the onset of rheumatic diseases. It can trigger the onset of flares in patients who have already rheumatic diseases, and also sometimes it can affect your response to therapy, the conservation of the drugs, and all of this can be also affected by the environment.
Okay, so that's it's quite a wide-ranging topic from what is at a global level down to the population level, but right down to your clinic level, if you like, with your patients. Um, Are there any specific things that was discussed with regards to what we should maybe? You mentioned diet as one example. Were there any things that perhaps we should be advising patients or telling them in terms of the concept of avoidance of some of these autoimmune conditions, or if they have it, try not to make it a bit worse. But also by doing that, how does that link back to the topic of the planetary health? Were there any specific examples?
Yes, I like very much what was said about the role of the doctor because our patients listen to us. So if you tell your patient, eat more plant-based diet and eat less meat and less sugar and less processed food, they will listen to you. So as a doctor, you have like a duty. You are responsible of the health of your patient, not just to give them the medication. So you are a role model. So what you do, they do like you, and also they listen to your advice. So if we are aware about the things that we can do to help our planet, like being more close to nature, like using less our cars, like having a more responsible diet, then the small things. But if everybody does the small things, and if we as doctors advocate for this to our patients, while telling them you can help the planet, but also you are helping your rheumatic disease, then I think even though those small steps can help and can make a lot of difference at the world level.
So a little goes a long way, they say, and everybody doing that together. But going back to this concept of sort of avoidance of risks, if you like, or prevention, from the kind of in the state of high inflammatory states where perhaps autoimmunity becomes a bit more prevalent in that situation. You mentioned about plant-based diet, exercise a bit more, and becoming less sedentary, which I think is general advice we should be giving our patients as well. In the area of the diet, was anything specific discussed? I know you mentioned plant-based diet, but is there anything we can be telling our patients?
Yes, so what is good for the planet is actually what we have been hearing about anti-inflammatory diet, including the Mediterranean diet, where you have a lot of place for vegetables, for fruits, and much less for red meat, less also for a little bit of dairy products, less sugar, less processed food. So all of this that we know that have an impact as an anti-inflammatory turns out to be also the thing that also have an impact in terms of environment. When you eat less red meat, when you eat less processed food, you are also helping the environment, not only your own health, your own disease.
The way I think of this is that a lot of things that we discuss from a scientific perspective, be it microbiomes or the oral health and how that may predispose to, say, rheumatoid arthritis, um, and that is at the individual level. In fact, it's very much linked to, as you say, the wider global perspective. By doing some of these things, they have effects, globally, which I think has a beneficial effect. I mean, one of the things that for many years we have been trying to understand is the role of, say, pollution, how inhaling some of these fumes perhaps may be a environmental risk for people developing, maybe some of the rheumatic conditions. So how do you see this link from what you could be doing here, reducing carbon emissions by reducing the maybe preparation of food that requires a lot of heavy production, reducing carbon emissions, perhaps might be beneficial longer term for the population with reduction in pollution levels?
Yes, I have personally worked on this project in Lebanon, and also there's a very acceptable amount of literature showing that, for example, if you live nearby a highway where you have a lot of small particles, you have more RA and more flares of RA. So this has been demonstrated in different studies. Now, working on pollution is very difficult because there's a macro pollution. So where you live, the pollution in the country, which is very connected also to the heat, to the humidity, to the temperature, which are all also connected to the pain, because now we know from our patients that the fluctuation in humidity and pain and the temperature are also related to fluctuation in pain. But so this is what is it confounding? Is it the pollution alone? Is it also the climate change? So there's a lot of interaction. And another level is the individual pollution. So the pollution that you have inside your house from the stove, from the heater. So these internal pollution now are being more studies with like detectors that are put inside the house. And you can link this with the flares of disease, of autoimmune disease, of systemic sclerosis, of lupus. But I know these are more like theoretical now because we have more ecological study, but we don't have prospective individual studies. And I think that the future will bring us more studies where you have the individual pollution, where you can like wear like a watch or something to measure the degree of pollution that is directly linked to you and correlated with your health status, whether rheumatic diseases or cardiovascular diseases, pulmonary diseases, even skin diseases, allergies are all related to this microenvironment. And I think that this is what will be studied in the future.
I think that's it's fascinating. This whole concept of host and environment. For a long time, we know that there is a genetic predisposition to conditions like rheumatoid, but you always need an environmental trigger. And that trigger has never, we kind of looked into many areas, but perhaps we should be kind of thinking at it more holistically in the concept of kind of planetary health, as you say, because these things have a wider impact from in the environment and from the things that we eat to the things that we breathe in the right genetic makeup could be the one thing that could be, triggering off some of these direction towards maybe autoimmune disease. When we talk about planetary health, often the topic of sustainability is often brought up, where we can try to reduce usage of certain things or think of how we can reduce the use of certain types of products. Now, thinking back, in within the hospital or within rheumatology, uh, where do you kind of see this happening, where there is, on one hand, the kind of wider discussion about planetary health, but at the second level, sustainability? How do we ensure that we are good in what we use, there's not too much wastage?
Yes, of course, the individual action are very important and awareness is very important. But more important also is the group action. So in the session also, there was a lot of talking about the green hospital. So the health facilities are also high producers of pollution, whether the waste, the many things that are produced in the hospital can be changed. For example, there was an example where there was a change in the cars of the employees of the hospital to make them more eco-friendly. And
Mm-hmm.
you can also change the way that you use the stuff that you can disposable stuff. Okay, so maybe use something that you can wash and use again. And so the hospitals can be a good starting place because they are a very important part of sustainability and also can be a good role models for the patients. So starting with your administration and thinking about how you can improve the hospital where you are working. So having what we call today green hospitals for green energy, many things at the level of the hospital can also make a big difference. So on top of the individual action that we can do.
Yeah, that's fascinating. I think these green hospitals, as you call them, or smart hospitals, must certainly create a better environment for the patients as well. Yeah, when they come in, that the micro pollution that you discuss, or the heat is and the environment around them must surely promote better health for our patients, but also become more sustainable, maybe using less energy. Were there any other topics from the session today? Was it seemed like a kind of it's come to the scene now here at this Eular, and I just was very interested to kind of see whether there were any other things that you wanted to highlight for our listeners.
Yes, I'm sure that when you are at Eular, you heard a lot about also equity, diversity. So this concept was also talked about during this session because unfortunately, there are a lot of inequities even in the health impact of pollution and planetary health. So people who are more populations who are more vulnerable will suffer more from these changes, these climate changes, the pollution changes that we are witnessing during the past decades. So unfortunately, it will not be the same for everybody around the globe. And this problem with the pollution, climate change, and its impact on health is not the same whether you are living in a high socioeconomic state or in a low socioeconomic state. Although the big polluters are the high socioeconomic countries. However, they will suffer less than the more vulnerable populations, and this is something also to think about on the global level.
Yeah. No, I think you clearly highlighted quite a few things that are food for thought, and this is probably something that will feature, I suppose, in kind of future meetings where, when we discuss the health of patients or group of patients, we should also be considering the impact of the environment around them, because we have been very focused on perhaps some of the more therapeutic agents that we have, but also how does this actually interact with the environment that the patients are in. In the UK, we are aiming to become net carbon zero in our hospitals by 2050. It's a challenge,
Yeah.
but I think it's good to have a challenge so that you can be thinking about reducing some of your practices where they might be less environmentally friendly.
Yeah.
How about
It
yourselves?
might cost a lot for now, but I think on the long term, it's worth as a cost.
On that note, on that positive note, we will say thank you very much to Nelly for taking time and explaining to us about this new session that caught my eye today, because it's I've been to a few ULAs. This is coming on the scene, and I think it's good to have a nice discussion about this. So thank you for your time today.
Thank you.